Hello and welcome. Today, we're going to talk about a condition called a bowel obstruction. Now, if you or someone you care about is going through this, I know it can be a really stressful time, probably filled with a lot of questions. So our goal here is simple, to give you a clear, calm overview. And we're going to focus specifically on the most common cause, the kind that can happen after you've had surgery on your abdomen.
All right, here's how we're going to break it all down. First up, what even is a bowel obstruction? Then we'll get into the warning signs and what to look out for. After that, we'll see how doctors figure this all out, what the treatment options look like, and finally, what you can expect on the road to recovery. Sound good? Let's jump in.
So, first things first, what are we actually talking about when we say bowel obstruction? Honestly, the best way to picture it is like a sudden traffic jam inside your digestive system. Everything that's supposed to be flowing smoothly just gets stuck. To put it a little more formally, it's a blockage that stops everything, gas, fluid, food, from getting through your intestines. And just like a traffic jam, this causes a major backup. The bowel starts to swell up, and that's what leads to a lot of the pain and discomfort you might feel. Okay, that naturally leads to the next big question. What could possibly cause one of these roadblocks in the first place? Well, it turns out there are a few different culprits. Doctors usually think about the causes in three main groups. The blockage could be from something inside the intestine, like a piece of stuck stool. Or the problem could be in the wall of the intestine itself, maybe from a tumor or inflammation. But we're going to focus on that third column, pressure from the outside, because that's where we find the single biggest cause of small bowel obstructions, scar tissue. And this right here really gets to the heart of the matter for so many people. This internal scar tissue, which doctors call adhesions, can form as your body heals after any kind of surgery in your belly. Think of them like sticky bands of tissue that can twist or kink or just plain squeeze the intestine shut, creating that traffic jam we were talking about. So how does your body actually tell you that this traffic jam is happening? Let's dive into the warning signs. Your body has a way of letting you know when something's not right, and it's so important to listen to it. This chart does a great job of showing the classic signs. I mean, look at that. Since nothing can get through, about 90% of people find they can't pass gas, and over 80% can't have a bowel movement. All that backup also causes visible swelling in the belly, what doctors call distension, in about 2/3 of patients. On top of those big three, you'll also likely feel abdominal pain. It might start out as cramps that come and go in waves, but then it can turn into more of a steady, constant ache. Nausea and vomiting are super common too, as everything backs up, and you just get this awful feeling of being completely full and bloated. Okay, so you're feeling these things, and you go to the hospital. How exactly does the medical team figure out for sure that you have a bowel obstruction? Well, it's a pretty methodical investigation. It all starts with a conversation. Your doctor will ask about your symptoms and your medical past, and they'll definitely ask about any previous surgeries. Then they'll do a physical exam of your belly. After that, some blood tests can check for things like dehydration. But really, the most important step is the imaging, which lets the team get a peek inside to see what's actually going on. The two main tools they use are X-rays and CT scans. An X-ray is a good first test. It can show the classic sign of a blockage, loops of intestine that are swollen up with air and fluid. But the CT scan, that's really the gold standard here. It gives this amazing, detailed 3D picture that can usually show exactly where the blockage is and often what's causing it.
And when we say accurate, we mean really accurate. For large bowel obstructions, a CT scan is right about 96% of the time. That is an incredibly reliable number, and it's so important for helping your doctors make the right plan for you, fast.
So that brings us right to treatment. Once the diagnosis is confirmed, the mission is pretty clear. Get that blockage cleared and get your digestive system moving again. And the good news is there's a well-established plan for how to make that happen. No matter what caused the blockage, the first steps in the hospital are all about making you stable and comfortable. First, they'll ask you to stop eating or drinking. That's to give your bowel a much-needed rest. Then, they might place a tiny tube, called an NG tube, through your nose down into your stomach to drain out all that backed-up fluid and air. Trust me, this brings a lot of relief. And of course, you'll get fluids through an IV to get you rehydrated. From that point, treatment usually goes down one of two roads. The first and most common starting point is non-surgical management. This is especially true for those obstructions caused by adhesions we've been talking about. It basically means continuing that supportive care to see if the blockage can fix itself.
The other path is surgery, which becomes necessary if the first approach doesn't work or if there are signs of a more serious problem. And here is the most hopeful part of this whole thing. For many, many patients whose blockage is from those post-surgery adhesions, this non-surgical approach works incredibly well. Look at this quote. Success rates can be as high as 87%. That means that most of the time, just by resting the bowel and relieving the pressure, that traffic jam clears itself up, all without needing another operation. That's fantastic news. All right, so what happens next? What does the road ahead look like? Well, whether your obstruction was fixed with or without surgery, the next steps are super important. And believe it or not, you play a huge part in your own recovery. Being an active partner in your own care is everything. It means really understanding what caused your blockage. It means following the diet advice your team gives you as you start eating again. And this is so important. It means knowing those warning signs we talked about, just in case it were to ever happen again. And, of course, make sure you go to all your follow-up appointments. To leave you with one final thought, knowledge really is power. Going into conversations with your doctors and nurses with some questions prepared can help you feel so much more in control of the situation. Ask them things like, what exactly caused my blockage? Or what's my personal risk of this happening again? And what specific symptoms mean I should call you or come back to the hospital right away? Asking these questions will make you a true partner in your care, and that can make all the difference.